We hear many different sounds in our daily life. But have we ever thought of how we can hear them? The ear and sounds. Ear autonomy. The ear is made up of the outer, middle, and inner ears. The outer ear consists of the pinna, the external auditory canal, and the tympanic membrane. The pinna collects the sound and amplifies it. The ear canal, or auditory canal, links the outer and middle ear. The eardrum, or tympanic membrane, converts sound waves into physical vibration. The middle ear. The middle ear consists of a tympanic cavity between the eardrum and the oval window of the inner ear, containing 3 small bones, the malleus, incus, and stapes. These together are called the ossicles. The stapes is the smallest bone in the human body. The middle ear also contains a narrow tube called the eustachian tube. Eustachian tube is a tube that connects the middle ear to the back of the nose. It equalizes the pressure between the middle ear and the air outside. How do sounds transmit to the inner ear? As sound waves enter the ear, they travel through the outer ear, the external auditory canal, and then strikes the eardrum, causing it to vibrate. The central part of the eardrum is connected to a small bone of the middle ear called the malleus. As the malleus vibrates, it transmits the sound vibrations to the other 2 small bones or ossicles of the middle ear, the incus and the stapes. The inner ear. The inner ear is contained within a hollow cavity in the temporal cavity of the skull called the bony labyrinth. The inner ear consists of 2 functional systems, the vestibular system and the cochlea. The vestibular system consists of semicircular canals and otolith organs. Semicircular canals lie at approximately right angles to each other, the interior, the posterior, and the lateral, which are responsible for detecting rotation. Each canal is filled with a fluid called endolymph and contains a sac called osseous ampulla at one end. Each ampulla contains a crista ampullaris, which translate flow of endolymph to nerve signals. The crista ampullaris consists of a cluster of hair cells encased within a gelatinous structure called the cupula. When the head turns, endolymph within the semicircular canals pushes the cupula in the opposite direction to the movement of the head. Otolith organs consist of utricle and sacula. These 2 connecting sacs are filled with endolymph, responsible for detecting linear acceleration. The utricle responds to horizontal movement, while the sacule detects vertical acceleration. Both as well contain sensitive hair cells called macula. Each macula is enclosed within a gelatinous layer. The top of this layer is covered with a layer of calcium carbonate crystals called otoliths. Tilting of the head allows gravity to pull the otoliths forward, triggering activation of the hair cells. The other functional system in the inner ear is called the cochlea. It has 3 compartments: the scala vestibuli, the scala tympani, and the scala media, otherwise known as the cochlear duct. Inside the cochlear duct is the organ of Corti. The organ of Corti contains the sensory receptors that are called hair cells. It sits on top of the basilar membrane and is covered by the tectorial membrane. Loudness. Loudness may be determined by 3 different ways. 1. As the sound becomes louder, the amplitude or degree of vibration of the basilar membrane and the hair cells increases. 2. By more cells becoming stimulated, this causes spatial summation of nerve impulses and more nerves stimulated. 3. Certain hair cells do not become stimulated until relatively intense vibrations are experienced. The range of sound frequencies that can be heard falls with age. But what are the factors that affect hearing? Genetics, medications, aging, excessive noise exposure, infections, and trauma. Almost all older people develop some degree of what is called nerve or sensorineural deafness. Deafness can be divided into 2 types. Sensorineural deafness, which is caused by damage of the cochlea due to noise-induced deafness and drug sensitivity. The second type is conduction deafness, which is caused by fibrosis of the middle ear due to repeated middle ear infections or hereditary otosclerosis of auditory ossicles. As conductive hearing loss is caused by fibrosis of the middle ear, and sensorineural hearing loss is caused by damage of the cochlea, the combination of conductive hearing loss and sensorineural hearing loss is known as mixed hearing loss. Some form of hearing loss can be improved with hearing aids, cochlear implants, and other forms of surgery. Sound travels as a spherical wave. Thus, as the radius of the wave doubles, the intensity decreases by a factor of 4. So how can we calculate sound intensity? Intensity is defined as the power per unit area carried by a wave, or in equation form, intensity is P over A. The most common approach to sound intensity measurement is to use the decibel scale, where sound intensity is based on the log 10 of intensity. An intensity of 10 to the minus 12 is the lowest intensity that can be detected by the human ear. Auditory response. The decibel hearing level scale is constructed by comparing the loudness of a sound with a 1 kHz sound of known intensity. Thus, the reference point is 1 kHz, and at this point, the decibel hearing level equals decibel sound intensity level. Let's pick 2 points on the graph. As you can see, the 2 points have different sound intensity level and frequency. However, they can have equal loudness as the hearing level depends on both the sound intensity level and frequency. The amplification processes. 1. The area of the tympanic membrane is half the area of the opening of the ear canal. The decrease in the area corresponds to a decrease in the diameter because the area is directly proportional to the diameter squared, as sound propagates as a spherical wave. The intensity equals the power over 4 pi r squared. Thus, when the area halves, the intensity doubles. 2. The lever function of the ossicles. These convert low pressure vibrations at the malleus to high pressure vibrations at the stapes, which in turn is transmitted to the oval window. They have a mechanical advantage of 2, which doubles the intensity of the transmitted wave. 3. The area of the oval window is about 20 times less than the area of the tympanic membrane. Sound conduction. There are 2 types of sound conduction: air conduction and bone conduction. To detect air conduction, the sound requires passing through the auditory route, the external, middle, and inner ear. An example is through conversations. Bone conduction is detected by the sound bypassing the aeroconductive route and is transmitted directly into the cochlea through the bones of the skull. An example is the sound that is produced in the larynx and transmitted to the cochlea by bone conduction. Hearing loss. There are 2 types of hearing loss: conductive and neural hearing loss. Conductive hearing loss is caused by damage or obstruction in either the outer or middle ear, which affect the conduction of sound to the inner ear. Neural hearing loss is caused by permanent damage to nerves in the inner ear. The X and O symbols represent the air conduction, and the left and right brackets represent bone conduction. In presbycusis, people lose the ability to detect high-frequency sounds, as whenever the frequency of the sound increases, their ability to perceive the sound decreases, and the sound loudness should be higher in order for them to hear the sound. Speech production. So our voices is a controlled flow of air through our vocal tracts, and Bernoulli's law is utilized to help generate these sounds. We can produce 2 kinds of sound: phonated and fricative. So fricative sounds are created by turbulent airflow within the cavity at the lips or through the teeth, while phonated sounds are the sounds produced by controlled airflow through vibrating vocal folds. These vibrations are then forced through the vocal folds, which help us to produce phonation. However, the sound that is produced also depends on the resonant properties of the vocal tract. Resonant effects. In a tube, if the tube length is equal to an integer multiple of the wavelength, a standing wave pattern may set up. The sound frequencies that set up standing waves within the tube are described as natural frequencies of vibration or resonant frequencies. If the tube is closed at one end, the NFVs coincide with those frequencies that produce a node at the closed end. Such tubes only generate harmonics corresponding to the odd integer multiples of the fundamental frequency. Therefore, we find that only sound frequencies which are allowed to pass down the tube correspond to its resonant frequencies, and all the others get filtered out. Thank you for watching.